Why does hyperpigmentation take so long to treat? Imagine trying to erase a mark that has been slowly building up over months or even years. That's what hyperpigmentation feels like to treat. It's not a quick fix, and here's why. When your skin produces extra melanin, the pigment that gives your skin its color, it doesn't just appear overnight. It builds up gradually, often because of sun exposure, inflammation, or hormonal changes. To see real improvement, your skin needs to shed those pigmented cells and replace them with new, even-toned skin. This process takes about 28 to 40 days because that's how long your skin naturally renews itself. But hyperpigmentation often requires several skin cycles to fade visibly. The depth of the pigmentation also plays a big role. Surface hyperpigmentation, which sits in the upper layers of the skin, can fade faster with topical treatments. But if the pigment is deeper, like in cases of melasma or dermal melanosis, it can take over a year of consistent treatment to see results. These deeper spots are harder to reach and requiring more patience. Asian skin, which tends to have higher melanin levels, is more prone to developing hyperpigmentation. This makes treatments more delicate because the skin is more sensitive and prone to irritation. If the skin gets irritated, it can trigger post-inflammatory hyperpigmentation, which makes dark spots worse instead of better. Sun exposure is another factor that slows down treatment. Ultraviolet light stimulates melanin production, so even if you are treating hyperpigmentation, unprotected sun exposure can cause spots to return or worsen. Using a broad-spectrum sunscreen with a high sun protection factor and ingredients like iron oxides is essential. But applying it every day, rain or shine, is necessary for success. Topical treatments such as hydroquinone, tretinoin, azelaic acid, or kojic acid can take several months to show noticeable results. These treatments work gradually by inhibiting melanin production or speeding up skin cell turnover. Sometimes, more aggressive procedures like chemical peels, laser therapy, or microneedling are used for stubborn cases. However, these can carry risks of side effects, especially in Asian skin, which is more sensitive. That's why they are usually reserved for persistent hyperpigmentation and requiring careful monitoring. Combining treatments and maintaining a strict sun protection routine is key. Often, a dermatologist will recommend a mix of topical agents, procedural options, and ongoing sun protection to prevent recurrence. This combined approach can take many months, sometimes over a year, to achieve clear, even skin. Patience is essential because rushing treatments can cause irritation or worsen hyperpigmentation. In Asian skincare, gentle, consistent care is especially important. Using ingredients like licorice extract, arbutin, and vitamin C derivatives can brighten the skin gradually without causing irritation. Avoiding harsh treatments that can trigger inflammation is also wise. Remember, quick fixes are rare, and slow, steady progress is the safest way to see lasting results. Hyperpigmentation treatment is a marathon, not a sprint, and with the right approach, clear skin is achievable over time.